Good afternoon, ladies and gentlemen. I would like to thank the organizers for the opportunity to present for you here today. First, before I start, I would like to state that I have nothing to disclose. Today, I will talk about COVID-19 and the inflammatory storm, and about omega-3 derived specialized pro-resolving mediators, or SPMs, and the resolution of viral inflammation. I'll also talk about the omega-3 derived SPMs in COVID-19, current knowledge and potential therapeutic targets. And lastly, I will talk a little bit about our clinical trial on resolving the inflammatory storm in COVID-19, the COVID Omega-F clinical trial. COVID-19 is a viral infection caused by the new coronavirus, SARS-CoV-2. This slide illustrates the different stages of the illness, with the severity here on the y-axis and the time course here on the x-axis. What became evident early on is that COVID-19 causes a wide range of symptoms, with majority of people, or about 80%, were either asymptomatic or get very mild symptoms. But then there are others that get worse and develop pulmonary problems here in stage 2, such as shortness of breath. And if this is not kept in check or treated properly, may eventually lead to an excessive inflammation or an immune system overdrive, resulting in ARDS and multi-organ failure. This is considered one of the major causes of death in patients infected with COVID-19, and as such, targeting this excessive inflammation may be an opportunity of rescuing severe COVID-19. But in a nutshell, what is clear is that when SARS-CoV-2 meets the host, it triggers a local immune response. In majority of the people, the immune response is adequate and effectively clears the infection, and the inflammation resolves. And as such, the inflammatory response is protective, and this is the case for people with mild symptoms or even asymptomatic. But in some people, there is an inadequate or delayed or imbalanced immune response, where the initial viral sensing is not controlled, resulting in uncontained infection and an excessive immune response. This can result in a cytokine storm or an inflammatory storm with excessive cytokines and eicosanoids. This is then associated with a number of additional complications, such as endothelial dysfunctions and a clot formation, increasing the risk of thromboembolic events and life-threatening cardiovascular complications, as well as multi-organ failure, and eventually can lead to death. This uncontrolled immune response observed in severe cases of COVID-19 and is associated with excessive pro-inflammatory mediator release, namely cytokines and eicosanoids, represents indeed the archetype for state of failure in the resolution of inflammation, and as such argues for failed resolution in COVID-19. Indeed, if we put this into the context of the textbook example of an acute inflammation, the early events in the host response are essential for survival and are coordinated by several families of pro-inflammatory mediators, including cytokines, chemokines, as well as lipid mediator, including the prostaglandins and leukotrienes, also termed eicosanoids. But central to an effective resolution is the lipid mediator class switch from the pro-inflammatory mediators towards the pro-resolving lipid mediator, or the SPMs, that then counter-regulate the inflammatory program and actively stimulates resolution and restoration to homeostasis. Indeed, defects in the lipid mediator class switch, or the SPM pathways, can actually undermine resolution and contribute to chronic inflammation, as we can see here. And this could potentially also be applied to COVID-19, where we have chronic inflammation and persistent critical illness, and potentially this could be undermining long-term COVID-19. But we can also have this undermining the cytokine storm, where we have a complete failed resolution and multi-organ failure. And I just want to emphasize that the failure in the resolution response may occur as a result of defects on several different levels in the SPM pathways. For example, we could have defects on the enzyme levels that affect both the initial as well as downstream synthesis of the bioactive mediators from the intermediate or the initial substrate. It can affect receptor expressions that can be altered both on genetic and post-translational levels, as well as downstream intracellular signaling. Furthermore, nutritional deficiencies in the essential polyunsaturated fatty acids, the arachidonic acid, the glucose, DHA, and the EPA, can detrimentally also impact the substrate availability for all downstream processes. Risk factors for severe COVID-19, such as aging, obesity, and cardiovascular diseases, as well as chronic obstructive pulmonary disease, have also been shown to be associated with impaired resolution responses and dysregulation in the SPM pathways. And even male sex has been, as we have seen, severe COVID-19 disproportionately affects males. And interestingly, it has been shown that males may have less efficient resolution of inflammation compared to females, where females may have accelerated resolution inflammation, and in part via higher production of SPMs. Hence, these further implicate a potential link between failure in the resolution response and severe COVID-19. And just to briefly emphasize again some of the characteristics actions of SPMs. SPMs, or specialized pro-resolving mediators, they are derived from dietary sources, namely omega-3 and omega-6 polyunsaturated fatty acids. They temper pro-inflammatory factors, cytokines, and eicosanoids. And SPMs are not immunosuppressive. Indeed, they stimulate the immune response, the phagocyte clearance of dead cells that we call efferocytosis, debris, and microbes to promote repair. And as such, they are termed immunoresolvents, and they are not immunosuppressive. In addition to these characteristic actions, some omega-3 derived SPMs have been shown to have direct antiviral responses. Here, the omega-3 derived protectins were shown to interact with the RNA replication machinery of an influenza virus and inhibit viral nuclear export, and thereby suppressing the pathogenicity of the virus. This study also showed that protectins were decreased in lethal versus non-lethal influenza, demonstrated of dysregulation in the pathway. And when added back, it enhanced survival of influenza infected mice. And the survival was further enhanced when combined with antiviral treatments, thus emphasizing this new concept of host-directed therapies, offering a new concept using SPMs to stimulate innate antimicrobial responses. There is growing evidence of the role of SPMs in viral infections. This study here, I just want to point out, demonstrated that the precursors, the 17-HDHA, the precursor for the DHA-derived resolvents and protectants, was shown to increase antibody production in H1N1 influenza infection in mice, thus alluding to the regulatory effect of SPMs in the humoral immune response against viruses, and thus further enhancing their therapeutic potential in complementing current antiviral strategies. Additionally, it is worth to mention that specific SPMs also counter-regulate some of the key pathological features of COVID-19. For example, they can attenuate pathological thrombosis, reduce netosis, promote clot removal, as well as stimulate efferocytosis of senescent erythrocyte. And this is in addition to their characteristic ability to counter-regulate pro-inflammatory mediators, including IL-6 and IL-1, which are at the center of the cytokine storm. Severe COVID-19 may be characterized, among others, by a lipidomic imbalance. As such, understanding the full anti-inflammatory and pro-resolving spectrum of these lipid mediators is of major importance in the current coronavirus pandemic. Eicosanoids are present in peripheral blood of COVID-19 patients, along with the resolvins, and there's a dynamic change with disease severity. This recent papers did a lipidomic analysis and showed a significant shift in the profile of lipid mediators with increased levels of arachidonate-derived pro-inflammatory mediators in serum from the COVID-19 patients. More importantly, the EPA-derived SPM RVE3 was significantly lower in patients with severe COVID-19 when compared to patients with moderate disease. And this provided the first indication that loss of a pro-resolving mediator or pro-resolving signal may be associated with more severe COVID-19. High levels of lipid mediators were also recently reported in the lungs of COVID patients. Here they found an increase in local pulmonary fatty acids, as well as pro-inflammatory lipid mediators with predominance for thromboxane, prostaglandins, and leukotrienes were also increased, thus marking the dynamic procoagulant inflammatory environment within the lungs of patients with severe COVID-19. They also identified pro-resolving mediators in the lungs from these patients and demonstrating the presence of several lipoxins and resolvins, as well as their precursor intermediates 18-HEAP and 17-HTHA that are also known to be bioactive. The presence of the pro-inflammatory eicosanoids and specifically resolvins and other SPMs in lung lavices at these biologically active concentrations from severe COVID-19 patients can suggest that these mediators may have functional roles in the lipid mediator storms of SARS-CoV-2. And this more recent study also identified plasma linolate diols, 18-carbon PUFAs from 18-carbon PUFAs, as a potential biomarkers for severe COVID-19, in addition to the more classical eicosanoids such as LTB4 and prostaglandins. I also want to briefly mention, in addition to these published papers, another soon-to-be published study has also identified pattern of lipid markers of inflammation that were much higher in patients with severe COVID-19 than a control group. These patients also had a very high clotting factors, as well as statistically significant higher ratio of pro-inflammatory versus pro-resolving factors when compared to the control group. And together, all these studies unmask the lipid mediator storm occurring in patients with severe COVID-19, in addition to the cytokine storm. Furthermore, individually, the SPMs RVD1 and RVD2 directly act to reduce macrophage inflammatory responses to SARS-CoV-2, and as demonstrated here. That is, when incubated with RVD1 and RVD2, macrophages secreted less of the key pro-inflammatory cytokines interleukin-8, TNF-alpha, and MIP-1-alpha after activation by SARS-CoV-2. And thus further reinforcing the potential therapeutic benefit of the omega-3 derived resolvins in COVID-19. And additionally, they also found that SARS-CoV-2 can directly activate SPM biosynthetic pathways in macrophages. Hence, the association between the excessive inflammation to worse clinical outcomes have led to the notion that targeting the cytokine or this eicosanoid storm may be an important part of rescuing the severe COVID-19 patient. However, therapeutic options currently considered for this purpose, including steroids, anti-inflammatories, COX-2 inhibitors, as well as selective cytokine blockades, may have serious side effects, as these are inherently characterized by a general immunosuppression, and as such may impede the host defense against the virus and potentially aggravate further the infection. Hence, instead, targeting the pro-resolving and SPM pathways and their metabolomes could provide a novel therapeutic approach for treating COVID-19 infections. One such potential approach could be dexamethasone, but it has been shown to upregulate SPM biosynthesis. And here we can see a hypothetical model of its mode of action that involves both inhibiting the cytokine storm as well as induction of pro-resolving mediators such as protectin D1 and resolvin D4 that act to reduce inflammation and promote its resolution, but may also help resolve coagulation and block viral replication. This kind of approach could result in notable benefits to patients. In addition to dexamethasone, these kind of effects could potentially be obtained by other means as well, including the treatment with omega-3 fatty acids, the initial substrate for SPM biosynthesis, which also been shown to have anti-inflammatory properties, or potentially by the monohydroxylated omega-3 intermediates directly, which are also available as supplements. In that context, a group in Spain is now in the starting phase to initiate a study, including the supplementation with Lipinova, an oral supplement containing SPM monohydroxylated intermediates, namely 17-HTHA, 14-HTHA, and 18-HEP, in patients suffering with long-term COVID. Given this rationale I have provided you with here today, we actually initiated a clinical trial last year that aimed to resolve the inflammatory starve in COVID-19 patients by omega-3 polyunsaturated fatty acids. This was a single-blind, randomized, placebo-controlled feasibility study. Here we aim to target the cytokine storm and stimulate the resolution of inflammation with anti-inflammation without immunosuppression. And if successfully completed, this would be a cheap and safe treatment, and as such could potentially be quickly implemented in an international treatment guidelines and improve prognosis in COVID-19. We published this mini review providing the rationale and the study protocol for the study. And as you can see here, the 3 phases of COVID-19 progression. And we hypothesize by given an intravenous entry proof of fatty acids, they can be quickly mobilized towards the biosynthesis of pro-resolving mediators to counter-regulate the hyperactive immune response and actively stimulates its resolution. And here we have the study protocol. We recruited COVID-19 positive patients that required hospitalizations and gave consent. And exclusion criteria included allergy to fish oil or omega-3 fatty acids, or other contraindications such as bleeding or shock, or would taking part in other COVID studies. Upon admission, the patients were randomized and either given omega-3 supplementation intravenously over 5 days, or natrium chloride placebo. On each day from baseline through day 5, clinical samples were taken for CRP, IL-6, IL-10, and white blood cell counts. In addition, at baseline, day 1 and day 6, 1 day after the last day of treatment, study protocol samples were collected for additional experiments with PBMC isolation and stimulation. Erythrocytes were collected, additional cells for RNA isolation and protein isolation, as well as for lipidomics. The primary outcome was change in inflammatory biomarkers. For secondary outcomes, we had change in pro-resolving mediators after 5 days of treatment, change in omega-3 index in the erythrocyte fraction, change in cardiac biomarkers, changes in biomarkers of organ damage, changes in thrombosis and coagulation, changes in infectious load, as well as effects on clinical parameters during hospitalization. So with this, we anticipated that intravenous omega-3 proof administration will decrease inflammatory mediators as a surrogate marker for potential beneficial clinical effects. We also anticipate an increase in omega-3 PUFAs and its downstream pro-resolving mediators. And by this, we hope to obtain the proof of concept for omega-3 PUFA treatment in COVID-19. Clinical parameters will be collected and presented in a descriptive analysis. And this will provide further information on the feasibility of the study protocol. And additionally, it will lay the groundwork for a larger randomized clinical trials on intravenous omega-3 PUFA administration on disease outcome in COVID-19. So with this, pro-resolving mediators and stimulating the resolution of inflammation provides a novel host-directed, non-immune suppressive approach to regulating excessive inflammation. Anti-inflammatories, as we currently know them, treat the initiation and block the inflammatory phase. Unfortunately, only about 50% of patients do not respond. There's also a lack of tissue recovery and can be a major system toxicity and potentially even a resolution toxicity. However, attacking the inflammatory response by actively stimulating resolution, by that we can counter-regulate pro-inflammatory mediators while we reprogram the innate and adaptive immunity and promote tissue regeneration. As such, pro-resolving mediators, they exploit patients' own tissue protective and reparative processes. They have modulatory actions and have a lower burden of side effects. And with that, I would like to thank you for your attention.